I think we can start now,
यस मैम स्टार्ट कर देते हैं.
है ना, because already अब जिन्होंने आना है कम से कम उनका टाइम तो ना वेस्ट करें ना.
ओके मैम.
Right, thank you. So, good evening, everyone. On behalf of Institute of Child Sangram Hospital, I welcome you all for this academic session. And today we'll be discussing a case which is pretty straightforward. A child who's got fever and joint pain. So it's pretty straightforward. So instead of going straight away to the straightforward case, we will, keep discussing at each point that what else could it have been and certain subtle differences because as far as exam is concerned, probably this case is not that great a case for an exam purpose. But definitely, if a practice is concerned, if you are sitting in a busy clinic or if you are sitting in a busy emergency and you see such a case, then it should straight away ring a bell in your mind that, oh yeah, I have heard such a case or I have seen such a case, and you should not be missing the diagnosis. So I think without wasting my time, I would request Dr. Shubham to please start his presentation. Shubham, over to you.
Thank you, ma'am. A very good evening to all. Myself, Dr. Shubham, second year DNB resident in Department of Pediatrics, Institute of Child Health, Sargangaram Hospital. Today, I'll be presenting a case of a 3-year-old child with case highlights as fever with joint pain. Now, starting from the social demography, the child name XYZ is a 3-year-old female. She is the resident of Meerut, Uttar Pradesh. History is given by mother and with the following complaints. Now, the chief complaints of my child was fever for 7 months. Initially, it was episodic, now regular from last 3 months. Second, it was difficulty walking and multiple joint swelling for the last 6 months, and noted child to be looking pale for last 3 months. Now, coming to the history of presenting illness, the child was apparently well 7 months back when she started developing fever, which was initially for 5 days, documented max 102.6 degree Fahrenheit, associated with chills and rigor. Took oral paracetamol, it was relieved, remained apyrexial for 2 weeks, and then again had episodic fever spikes with no other associated symptoms like cough, coryza, loose stool, vomiting. The fever had a diurnal variation, it was more in evening, and difficulty walking. Firstly, it was noticed by the parents 6 months back as limping, followed by a fall. Associated with pain, child used to point towards her legs while sitting or trying to get up from the bed. Then it followed with multiple joint swelling, first starting from the bilateral ankles on the lower limbs, as appreciated by parents as fullness of the joints. It was equal on the both sides, then followed by swelling over the knee joints and then elbow joints over the coming months, and gradually progressive and additive. Associated with the decreased active and passive movements, the child refused to bear weight and did not allow anyone to touch her joints, not associated with redness of the skin overlying the joints. Now, parents consulted with the orthopedicians in the city. Some joint X-rays were done, uh, which was said by the parents, which was said to be normal. The reports were not available. And the child is having pallor for the last 3 months. It was noticed by parents as whitish and yellowish discoloration of the face over time.
Dr. Shubham, can I interrupt you here? And before we
Yes, ma'am.
go further into things, let's start learning. Yeah, so go back to your first slide, please. Yeah, go first slide. Let's go to the age of the child and let's go there. Right. So we have a 3-year-old female child. So we will all remember the age of the child is 3 years female. Next, please. Right. So now we the child has got fever of 7 month duration, episodic or regular, whatever, but 7 months. So now the child has got fever and the child has also got a long-standing joint swelling involvement and the child is looking pale for 3 months. When you look at the complaint, what is the first thing that comes to your mind? The very first thing.
Ma'am, yes, ma'am. Ma'am, looking from the complaints starting at the fever. Now, since the complaints are like for 7 months now, I can think that something chronic is going on, ma'am. And
Right.
secondly,
So first thing is that so let me rephrase my question. What can you rule out easily looking at this?
yes, ma'am. Looking at easy from this history, ma'am, I can rule out some acute infections and acute post-infectious causes, which are usually succeeded by fever, ma'am.
Very good. So you can very easily and safely say, "Bhai, this is not dengue, typhoid, malaria. You know, this is not some acute viral illness." So you're very clear about that, right? So I'm sure all participants and now the number of attendees has increased considerably. So I can say with confidence that everybody would be quite okay and happy to say that yes, this is not an infection, right? So that much is clear. This is not any acute infection. So that much is clear, and that is how we should be, as far as we should be working in that direction, that we should know, okay, ये नहीं. So that is also important. So जितना important ये समझना है कि ये क्या हो सकता है, इसलिए उतना important ये भी बोलना है कि ये नहीं हो सकता. So if such a child comes to you, and if you're still ordering tests like typhoid, malaria, dengue, then that is not very fair. Yeah, so one thing is clear. Now next,
Yes.
yeah. So now we have this child. We are going deep history. We know that this child is getting episodic fevers, right? And now, what do we want to understand this fever? What is something which is missing from here? Something which, if asked or if you know, would kind of take you more towards your diagnosis. Any can put down the chat box. Anything that you would ask for, you would think of, and or you would in the fever, in the history of fever, if you want to ask something more, or do you want to know something more about the fever? That is not written over here. Shubham, do you
Sorry to
realize anything not written?
sorry to interrupt, ma'am. Ma'am, actually, my network is a little. I have to change my network, ma'am. Can I take like 10 seconds?
Yeah, you take it.
Thank you.
So meanwhile, all the participants could put in the chat box what is there in the history of fever. What is one history that you want to know in this fever that would help take you more towards the diagnosis? Anybody who answers this question right now without using artificial intelligence, message me and bring a chocolate tomorrow. आंसर की बात सुन के नंबर ही कम हो गया. चलो कोई बात नहीं. So let us see if Shubham has rejoined. Shubham, have you rejoined?
Yes, ma'am. I've changed.
Okay. So Shubham, no ready to answer. What do you?
Am I audible, ma'am?
Yeah, you're audible, but now you answer my question.
Yes, ma'am. Yes, ma'am. Can I
What
know your
have
question, ma'am?
you? Yeah, what have you in the history of fever when you are out for fever? What have you missed in this fever history?
Fever, ma'am. Ma'am, actually, I mentioned duration, the grade, and the onset. Ma'am mentioned actually frequency. I have missed, ma'am. I think frequency of fever. I have missed in.
Yes. So you have missed the frequency of fever. That's one. also even one more thing, two actually. So is the frequency of fever important?
Yes, ma'am. Frequency of fever is important, ma'am, because and since if we are thinking something from the rheumatological point of view or something from the juvenile arthritis point of view, the frequency is important, ma'am. And if we are thinking of malignancy again,
No.
the frequency is important because it is associated with collapsing pattern of the fever, ma'am. And in GI it is usually,
So
ma'am, quotidian fever.
what is chylexin type of fever? Remind everybody, everyone has read it in their medicine, but what is remind everybody?
Yes, ma'am. Ma'am, it is a relapsing fever which is usually seen in lymphomas, ma'am.
Yes, all type fever.
Like it is, like fever lasting 1 to 2 weeks, and then it is followed by an afebrile phase, ma'am. Then again, it starts having the child starts having fever, ma'am.
So something like what is epilepsy type of fever? वो like आया चले गया ऐसा होता है epilepsy या कुछ और होता है epilepsy? ठीक है,
Ma'am,
Shom,
usually it
that's
is
homework for you.
cyclic,
Chalo,
ma'am.
that's homework for you. That's homework. Now,
Okay, okay, ma'am.
and else fine. So what else? So one is frequency that yes. So in a day, how many is the child getting? Yeah,
The child usually had, ma'am, 1 or 2 spikes, ma'am, per day, ma'am.
2 spikes. And then another history now related to this.
And another, ma'am, grade I
Hmm?
have mentioned, frequency, grade I have mentioned, ma'am, and diurnal variation I have mentioned.
Another history find out does the fever does the fever touch the baseline or not?
Yes, ma'am.
And
Yes, ma'am.
you
Yes,
will
ma'am.
ask how is the
Yes, ma'am.
child
Right. Ma'am.
the child is right fever. So if I will not see this history, any fever, especially about coming to you, chronic fever, you are not doing a good job. You need to the duration of this fever. You need to ask what is the frequency of this fever. You need to ask in a day what is the frequency of this fever. What is the
Yes,
highest
ma'am.
spike going up to? Is the fever touching baseline? After that, is the fever touching baseline or not? And then, how is the child in afebrile period? And we will discuss the importance of this shortly. Next.
Yes, ma'am. Then, ma'am, child had difficulty walking. It was noticed first
Yeah,
time by the
this is
parents.
okay. This is okay. Yeah, so इस पे भी डिस्कस कर लेते हैं. So what does this imply? This
Uh,
difficulty walking. What does this imply? What do you understand?
Ma'am, the parent first noticed that the child was limping and it was associated with discomfort, which is associated by fall. So there is something musculoskeletal issue which must be going on, or something related to the joints or the long bones, ma'am.
So we understand that they are looking. So again, what can it not be?
Sorry, ma'am, your voice is
You're
breaking, ma'am.
seeing a child. You're seeing a child with fever
Yes, ma'am.
and arthritis. So you're seeing a child who's got fever and who's got joint swelling. So fever and arthritis is your cause detention. If I give you just two words, fever and joint swelling,
Like I'll think of, ma'am, starting from the age group and the history seems to chronic, and I will first think of, ma'am,
no,
juvenile.
forget the chronicity. What do you think
Okay,
of?
just, ma'am, fever and joint swelling, ma'am.
हाँ जी.
Ma'am, just thinking from the joint fever and joints, I would first think of infections, ma'am.
Yeah.
And
So what first thing? Septic,
infective and post-infectious causes, ma'am.
so you will think of septic
Septic
arthritis.
arthritis, yes, ma'am.
Thereafter,
Could
you
be
will next think
tuberculosis.
of
It could be dengue, chikungunya, ma'am.
भैया ओ रुक जा रुको you will think of with fever. I'm not giving any other thing. I'm just saying you've got fever and you've got arthritis. You'll think of septic arthritis. You'll think of reactive arthritis.
Yes.
So in reactive arthritis, you will think that could be an arthritis secondary to viral arthritis like chikungunya,
So,
or is it an
dengue.
reactive arthritis second chronic infection like tuberculosis? All right. In TB,
Yes, ma'am.
you typically don't get fever when you have joint involvement. You will get fever in acute phases, but involvement usually is a reactive arthritis. Typically does not have fever.
Yes, ma'am.
Okay. Now, when you have fever and as you rightly said, you will want to know the duration. And as you keep moving away, and as the number of joints keep on moving, you know that it is less likely or unlikely to be arthritis, at least in an immunocompetent host. Right? So now, because you're a second year, if you were in your first year, I would not have queried you further. But if I have a 1-year-old who come to me with fever and swelling, I have a 1-year-old boy who come to me with fever. He come to me with fever and he's come to me with 4 joint swelling. He's got high skin fevers. His ESR and CRP are elevated. He's had a history of ear discharge at 4 months age. What would you think of? I'm sorry, I'm digressing from this case. What do you think? And it's very important because I was about to ask if this was a 3-year-old boy and you would have had this history, what would you have wanted to rule out? So, what would you think of? You want me to repeat the history?
Fever, joint swelling, ma'am. Ear discharge, ma'am.
1-year-old boy, history of a ear discharge at 4 months of age. Presently, at 1 year of age, he's coming to you with a fever of say 1 week, and he's got 4 joints swollen. His ESR TLC is high. What can Oh, it is a great question.
Actually, ma'am, I don't know what's happening. There is something issue. Your voice is breaking.
My voice is breaking.
Yes, ma'am. It's very.
Hey, the signals are full here. Can you
अपना वीडियो बंद कर दो, आप कैमरा ऑफ कर दो.
वीडियो ऑफ करूं? ओके, अभी देखो.
Yes, ma'am. अब आ रही है.
अभी ठीक है?
Yes, ma'am. Better.
Okay.
Thank
Okay.
you, ma'am.
So what would you think of? Did you get my history?
Yes, ma'am. Actually, ma'am,
1-year-old boy,
Yes, ma'am.
1-year-old boy presents to me with history of a ear discharge at 4 months of age, and at 1 year of age, he's come to me with a fever of 1 month of 1 week duration. He's got 4 swollen joints. What do I need to rule out? No.
Like, ma'am, septic
Any
arthritis.
of the participants want to rule out? Very good. Septic arthritis. So, what would you think of? Why are you thinking of septic arthritis with 4 swollen joints?
usually
Do
it's
you get septic arthritis with 4 swollen joints?
no, ma'am. It
Can you
usually is only the
can you
one.
get can you get septic arthritis with 4 swollen joints?
No, ma'am. It's usually one or two. Not.
Usually 1 or 2, but you can get. What is that condition?
Is the condition insets? Oh, yes, chat. I have to
Okay,
read,
so
ma'am.
let us go further. So you would think of chronic variable immunodeficiency, a CVID, or a X-linked A gamma globulinemia, that is Bruton's, for such a child. And I gave you a clue. This was a male child
Yes, ma'am.
who had 1 year discharge at 4 months of age. And now at 1 year of age, this child is presenting to you with fever and 4 swollen joints. You need to rule out a
Okay. Immunodeficiencies.
hypogammaglobulinemia or agammaglobulinemia. You want to rule out whether the child has
PP.
got a secondary
Deficiency.
immunodeficiency. All right.
Yes, ma'am.
So please do not forget that.
Okay, ma'am. Thank you.
All right. Chalo.
Yes.
Next.
Now coming to the negative history of my child, there was no history of abdominal distension, there was no neck swellings, there was no weight loss, bleeding from any side, any history of recurrent infections requiring admission, and no history of night sweats. Secondly, there was no history of tuberculosis contact and intake of raw milk. There was no history of rash. There is no history of photosensitivity, malar rash, oral ulcers, seizures, that is discoloration of urine, and no history of preceding genitourinary or gastrointestinal infections or sore throat. Now, coming to the past history, there is no history of similar illness in the past. The child was admitted recently in Mata Chanan Devi Hospital, Janakpuri, 4 months back, in view of fever, where she was being treated for enteric fever. The IV antibiotics were given for 10 days and investigations were done. And now these are the investigations which were done there. First, there is a complete blood count showing hemoglobin of 5.2 gram per deciliter, hematocrit of 18, and red cell indices on microcytic hypochromic side, and increased red cell distribution width to 22.4, and a neutrophil count of 61%, lymphocytes of 31%, and platelet count of 8 lakhs. And secondly, the CRP was raised, it was 161. The ferritin was 91.7 nanogram per ml, and the RF was 28.32. Now,
So,
this was
Doctor,
the
what is your interpretation? Go back to your previous slide and interpret the CBC and the other investigations for me, please.
yes, ma'am. Now, interpreting the CBCs, ma'am. Firstly, there is hemoglobin is 5.2, so the child is having severe anemia. And red cell indices is on the lower side, so it is microcytic hypochromic, and the leukocyte count is normal with normal differentials count, and platelet is on the higher side, uh, likely due to reactive thrombocytosis, which can be seen in anemia as well. And CRP is raised and 161.32. So it is suggestive some acute inflammatory process is going on, since CRP is a positive acute phase reactant, and ferritin is normal 91.7 ma'am, and rheumatoid factor is elevated ma'am 28.32.
So, do you think this child has got a uh, rheumatoid arthritis?
Ma'am, from a single test, we can't label it as rheumatoid arthritis. Actually, we need two readings, two positive readings, which should be at least 3 months apart, ma'am, before labeling it as RF positive.
One more thing is needed. The value should be more than 2 times upper limit of lab norm. All right.
Okay, yes,
So this is not to be considered.
yes.
All right. So please remember that the titer is also important. Just a positive or a negative is not enough. This titer of rheumatoid factor is considered to be insignificant. All
Okay,
right.
yes, yes,
One.
ma'am.
Now, suppose this child's um, platelet count was 200, and suppose this child's neutrophil count was 30% and lymphocyte count was 70%.
Okay.
What would
So
you have?
neutrophils 30% from the TLC of 7,200 roughly means, ma'am, ANC is 2,100, which is on the lower side of the normal limit, ma'am, only. And there is lymphocytosis uh, for 70% is would be around 5,000, ma'am. So it could be suggestive of some, ma'am, an inflammatory, autoinflammatory condition, ma'am.
No, Shubham. So we would think of a malignancy in such a condition when we have a reversal of count, when we have a lymphocytosis, we would be thinking more in terms of a malignancy than why is
Yes.
there a lymphocytosis. All right, with a
Yes. Yes.
reversal of counts, and even if your platelets are normal. So please don't forget that.
Yes.
Okay, right. Next.
Yes. This was the 2D coup which was done, which was essentially normal.
Hmm.
Now coming to the birth history, the birthplace was Meerut in private hospital. The mode was vaginal delivery. The child was delivered at 38 weeks of gestation. The baby cried immediately after birth. Birth weight was 2.7 kgs, and there is no history of NICU admission.
Hmm.
Now developmental history, the child achieved milestones according to the age, and the child was immunized according to the national immunization schedule.
Hmm.
Now coming to the family history, there was no history of similar complaints in family members. There were no history of malignancy in family members and distant relatives. There no history of any rheumatological or autoimmune disorders, and there is no history of tuberculosis.
Hmm.
Now, to summarize my history, it would be 3-year-old female born of term vaginal delivery, all developmental milestones achieved normally and fully immunized, admitted in Sir Gangaram Hospital with complaints of fever for 7 months, limping associated with multiple joint swelling for the last 6 months, and pallor for the last from the last 3 months. So the differential diagnosis of my from the history point of view would be: first, I would like to keep my differential as malignancy, leukemia. Secondly, I would like to keep as a rheumatology and autoimmune disorder like systemic GIM. And second, infections I could think of at last, it could be Ponson's disease, tubercular rheumatism.
क्या क्या कौन सा rheumatism? Tubercular rheumatism.
Yes, ma'am. It's Ponson's disease is the name.
The reactive arthritis to
Yes, ma'am.
TB. Yeah.
It's a form. Yes, it is a
Okay.
non-erosive reactive arthritis due to tubercular
So
bacilli
what is,
antigens.
yeah. So what is the typical pattern of joint involvement in a malignancy? Why am I reasonably confident in saying that this is not a malignancy?
Yes, ma'am. Ma'am, usually in malignancy, ma'am, small joints are involved, like wrist joint, ma'am, and joints of the digits, ma'am. And usually, the swelling is the pain is out of proportion of the swelling in malignancy.
So Shubham, I need to correct you there. So small joints are not involved in malignancy. We don't get digit involvement in malignancy. In fact, in malignancy, we get the musculoskeletal complaints are usually of which pattern? What is the what is the pattern of the joint involvement? You had used that word in
Usually
your
leukemia. Yes, ma'am.
eh?
Usually, ma'am, in leukemia, there is not a true arthritis. It usually doesn't involve the joints. There is usually, ma'am, bony pains due to the infiltration of the periosteum or by the leukemic cells, ma'am. And it usually involves a metaphyseal region and the shaft and the bony pains. True
Right. So
effusion is
that is one aspect of what you're saying. So one aspect of what you're saying is right, that there would be bony pain, and it is usually a bony pain and bony involvement, and not not a true arthritis, but it is only partially correct because you do get synovitis, and you do get synovitis, and you do get synovial fluid also in a malignancy, and you can get multiple joint involvement also. But I'm asking you, what is the pattern of joint involvement? So joint involvement तो होती ही है. What is the pattern?
Like the number of the joints involved or the
No, you have to tell me what is the pattern. What do you understand by pattern of joint involvement? Have you ever heard of this term, that there are patterns of joint involvement?
joint involvement.
Yes, no, don't know,
Um,
don't care.
like ma'am, if you're asking about symmetrical, non-symmetrical, and
Yeah, so that is a pattern.
polyarticular and
Yeah,
oligoarticular.
that is a pattern, yes.
Yes.
So there are patterns of joint involvement. One pattern of joint involvement is that whether the joints are symmetrical, asymmetrical, whether these are large joint, small joint, and then there's a pattern of whether it is fixed, additive, or migratory.
Migratory, yes ma'am.
Yeah. So what kind of a
Usually,
pattern is there in
usually
looking?
it's oligoarticular, ma'am. Could be monoarticular,
हे
malignant
नंबर कहाँ पूछा मैंने?
pattern.
चलो और so the pattern of joint involvement in a malignancy is typically asymmetrical,
Asymmetrical.
typically migratory. In which
Yes, ma'am.
condition do you see migratory pattern other
Acute
than
rheumatic fever, ma'am.
acute rheumatic fever? Anything else? Any other condition? चल छोड़, आज ज्यादा रैगिंग हो जाएगी फिर. ठीक है. So what do you here had said that this was an additive joint involvement. What do you understand by this term? Do you
Like
understand?
ma'am,
Hmm.
one joint was involved, and there was subsequent involvement of the other joint with the involvement of the former joint persisting, ma'am.
Very good. So the first joint did not resolve, and
Yes,
you
ma'am. It is
recruited more joints, and you recruited more joints.
more
So
joints. Yes.
that's additive. And in acute rheumatic fever, all in a malignancy, what do we see? We see that there is one joint which is swollen, and then we get other joints which get involved.
Yes,
All
ma'am.
right. And
Yes, ma'am.
also, there is a problem that these joints, not only do they get involved, as you rightly pointed out, the pain is much out of proportion to the joint involvement. And the term you were looking for was periarthritis or periarticular
Carry.
involvement. So the
Yes, ma'am.
involvement is typically not just of the particular joint, it is of the area around the joint as well. This
Yes,
is
ma'am.
not the case with JIA. JIA is a much more chronic illness, and children, they adapt very well to their joint swelling, and you will see a child with 10 swollen joints also comfortably, lying down, sleeping, or moving, or
Mhm.
even, playing. That the parent would say that only. And what else do you see? You see a lot of gelling overnight. So you see
Yes, ma'am.
morning stiffness in the
Jai.
joint. So the
Yes.
child would complain in a inflammatory arthritis. The child would complain to you in the morning. The child would not want to be woken up or want to walk in the morning. The child would not like to be held in the morning. The small child would not like to be picked up in the morning. And this child would gradually, as the joints will move and as the synovial fluid gelling will reduce with improved blood supply, this child will then start moving and walking around. So the parents would say that morning 4-5 hours are difficult, or 2-3 hours are very difficult, and then the child starts moving and walking, yeah, or moving the involved joints, whatever. And then the fever classically in JIA, which subcategory of JIA can have fever?
Ma'am, the systemic GI
Like, so that is one
usually has
subcategory which
gastric
can,
fever.
yeah. So that is one subcategory which presents to you with fever. And here, sometimes you may get only fever, and that is the difficulty in diagnosing systemic GIA, that they may present to you only with fever,
Mhm.
and the joint involvement may take time. And
Yes.
sometimes, when these children get fever and then they recruit only one or two swollen joints, then erroneously they are managed in, at least in tier 3 cities and in periphery, in villages and small towns, they are managed as tuberculosis. So suppose there
Yes.
is one knee, one ankle involvement and the child is running fever, so they are given ATT erroneously. Or in many regions they are given Penidur, penicillin injections, erroneously being diagnosed as
Yes. Yes.
acute rheumatic fever, especially
Yes,
if
ma'am.
the child's ASO titer comes a little elevated. So these children are then given subjected to Penidur for many, many years. So this is something very important to realize, that the pattern of joint involvement helps you to differentiate. You don't even need to look at the bloods. You don't even need to examine the child to understand. It's only a clear history which will give you a diagnosis. You will be able to, अभी तक हम examination पे भी नहीं आए, and we are clearly able to say
Yes, ma'am.
that this is a child who's got chronic fever. This is a child who's got multiple joint involvement. This is a child who's pale. This is a child who's otherwise looking well. This is a child whose sleep is not disturbed. This is a child who's not losing weight. This is a child who's not waking up at night screaming with pain. So this is a child who, in spite of having swelling of multiple joints, is not distressed. And this is a child who is more likely to have a autoimmune disorder. And out of those, systemic GIA is the foremost one, right?
Yes, ma'am.
Chalo, now quickly come on to your exam.
Yes. Mm. Now coming to the examination part, starting from the general physical examination, the pulses are
So
92 beats per
nothing
minute.
major over here, so you can move on to the. Just tell
Okay.
me something that, see, the child had fever, so I'm
Yes, ma'am.
saying that it is likely to be systemic GIA. What is one exam finding which, if you would have seen, you would have been reassured कि हाँ भाई चलो ये systemic है.
Ma'am, rash, ma'am.
Very good. So what type of a rash do you see or expect in systemic GIA?
Yes, ma'am. Ma'am, usually in systemic GIA, usually we get an evanescent, non-fixed salmon colored pink rash, ma'am, which is
So
usually seen with
so
spikes of fever.
describe it in simple English. What do
Simple
you
English,
mean by
a
evanescent? What do you
rash
mean
which
by evanescent?
a rash which will arise with the spike of the fever and will usually disappear when the fever subsides, ma'am.
So evanescent word का मतलब क्या होता है?
It is, ma'am, non-fixed, ma'am. It will change. It is like
Very good. So
fleeting in
evanescent का मतलब होता है which is transient, which will come and go.
common. Yes,
ठीक
ma'am.
है? So that is
Yes.
evanescent. So then that rash is evanescent, and then when you say it's a salmon colored rash, what is the salmon color? क्या होता है salmon?
It is typical pinkish, light pinkish color.
Salmon है क्या?
Fish, fish.
So salmon is a pink colored, light pink colored fish. So this rash is said to be salmon pink in color. And typically, where do you see it?
Maybe there is no fixed for we seen on
Sorry?
like trunk.
हाँ,
Usually seen with ma'am episodes of fever and
पर
usually
कहाँ
there
पे
is
देखते हैं?
ma'am it could be seen on trunk, ma'am.
Oh, and
Just in trunk.
trunk and
Trunk and face.
Shubham.
Face.
So Shubham, this rash is seen not only on the trunk, but it is also seen on the unexposed parts of the moist parts of the body, like the axillae and the medial sides of the thigh.
Okay.
And that's a very common site to find this rash. And when you have a child with very high grade fevers, or moderate grade fever with plus minus joint swelling, and you are suspecting systemic GIA, then when the child gets fever, please tell the family to undress the child and look for this pale pink colored rash in the axilla, thigh, abdomen, trunk. It's less likely to be there at the back. It's less likely to be there on the face, but still it is seen on the face and the back also. You will usually not see it on the legs, but in very sick children, we do see it all over. But typically, it is seen on the unexposed, moist parts of the body, like the axilla and the medial aspects of the thigh. Okay?
Okay. Yes, ma'am.
When the fever goes down, the rash disappears, and it is often, is it itchy or non-itchy?
Usually non-itching.
Usually non-itchy, but sometimes it can be pruritic, but it is
Right.
not
Sometimes
intensely, but it is not intensely pruritic. It is
intensely.
typically not a pruritic rash.
Yes, ma'am.
Yeah. Okay. Next. And what
And
else
then,
do you expect over there in the, sorry, एक बार वापस जाओ. What
yes.
else do you expect in the general physical exam?
Ma'am, I'll come to general physical examination from head to toe examination on
अच्छा ये
next
अभी
notes.
वाइटल, ये अभी
Yes,
सिर्फ
ma'am.
वाइटल है यहाँ पे.
Yes, ma'am.
ओके,
It's right. Just right.
आ जाओ आ जाओ. नेक्स्ट. हाँ, ठीक है. ओके, फाइन. Everyone has read this. Next. Hmm.
Denies the palpable presentment. There's no pus and there's no ears, no discharge. Neck, there was no significant left-sided level 3 lymph nodes were palpable, and abdomen was soft and usually non-tender and non-distended.
Yeah. So typically in systemic GIA, we expect some lymphadenopathy, and some children can have really exuberant axillary and cervical lymph nodes.
Yes.
Hmm. चलो 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 जल्दी
Now
चलो.
coming to the musculoskeletal system, and the gait cannot be evaluated as the child refused to bear weight due to pain and discomfort. The child was lying in bed in supine position with some discomfort. Now coming to the arms inspection, the swelling was not noticed over the bilateral elbow and the wrist joint. Skin over the joints was non-erythematous. There was no rash, sinus, or obvious deformity seen. On palpation, there was local rise of temperature. There was a soft, boggy swelling appreciated over bilateral elbows and wrist joint. It was associated with decreased passive range of motion, noticed with physical discomfort and withdrawal when I tried to move the joints of the child. Second, legs inspection, lower limbs were exposed, knees were in semi-flexed position, bilateral knee and ankle joints were swollen with normal overlying skin. There was no atrophy, rash, sinus, or no muscular atrophy, rash, sinus, or obvious deformity seen. Palpations, there was soft, boggy swelling felt over the joints, associated with tenderness, local rise of temperature was there, and there was obvious decreased range of motion. Spine was closely normal. Now, these are the pictures which I have taken with due consent from the parents. This is showing the joints, the bilateral knee joints, showing a boggy swelling over on the superior, medial, lateral, and just lower inferior aspects of patella, showing the fullness of the joints, and the skin overlying the joints seems to be normal. There is no, it is non-erythematous, and it was associated with the local rise of temperature on palpation, and it was tender.
Mm-hmm.
These are the little part of the rest. Now coming to the systemic examination. On per abdomen examination, the child was examined in supine position. Abdomen was
Carry
non-distended.
on, carry on, carry on.
Okay. Just there was on palpation, it was palpable 3 centimeter. The span was 11, and percussion auscultations were normal. The respiratory system again, it was normal, and CNS were also normal. Now, coming to the diagnosis after the thorough history and examination, I would like to summarize my case as 3-year-old female, born of term vaginal delivery, all developmental milestones achieved normally and firmly immunized, admitted in San Gangaram Hospital with complaints of fever for 7 months, limping and multiple joint swellings for 6 months, pallor for the last 3 months. On examination, has pallor, hepatomegaly, and multiple joint swelling involving ankle, knee, wrist, and elbow joints with normal skin overlying the joints. Now, again, the provisional diagnosis of my case would be systemic juvenile idiopathic arthritis to rule out malignancy.
So how do you plan to rule out malignancy in this child?
By investigation partner,
No, but why?
by history and
Why would
examination.
you? I'm pretty confident that this child would be having, what are my red flags in this history?
Ma'am, just there was ma'am like organomegaly and fever and joint pain
अरे
were
तुझे अभी
there.
तो तूने पता में गैली बोली भाई.
Yes.
No, didn't you say hepatomegaly?
Yes, ma'am, hepatomegaly.
So, to be very honest, Shubham, in this case, although this is fine that you're saying this, but in this case, I'm pretty confident that this child has a systemic GIA because if this was a malignancy, this is a 7-month duration we are talking about, and this child has got multiple joint swelling, right?
Yes, ma'am.
So this child has got fixed arthritis. That is not a feature of, that is what I said. This case is so straightforward that
Okay,
here
ma'am.
you don't even need to investigate.
Okay,
Yeah, I would
okay,
not
ma'am.
do 90% of the investigations in this case because this case is so straightforward. I would be able to say that yes, pretty much confidently, if I'm seeing so much of a joint effusion, so much of synovitis in so many joints. You're saying that the elbows, wrists, knees, ankles, everything is swollen. So I am quite confident that this is not a malignancy. This is more likely to be a JIA, more likely to be systemic JIA given the history. And in fact, all my investigations, of course, I will run a CBC, ESR, CRP. Already this child has got a CBC hanging around over here. So I would just do simple investigations, and I would do one thing that I would definitely want to make sure that the child is not carrying any tuberculosis because I want to immunosuppress this child. So I would definitely be doing a X-ray chest, ultrasound abdomen, and I would definitely
Yes.
be doing a Montu test and probably doing a IGRA TB test as well to make sure that my child does not have any latent tuberculosis. And that too
Yes, ma'am.
because I want to immunosuppress this child. Not because
Yes,
I'm
ma'am.
thinking that this child has got a TB. I'm sure this child does not have any tuberculosis and I'm sure that this child does not have any other complaint. Yeah, so am I clear? Do you have any questions still here?
No, ma'am, it's clear, ma'am.
Yeah. So you've understood
Yes,
what I
ma'am.
was saying, alluding to. So your history is so important. And that is why I requested you to take this case because the history was pretty straightforward here. And this is something that you should, be able to say that, okay, this is inflammatory, this is non-inflammatory, and this is sinister. So these are
Yes.
your pointers that you will say that, okay, this is inflammation, this is not inflammation, and this is sinister.
Yes, ma'am.
Okay? So
Yes. Thank you.
can we call it a day? Because I'm
Yes,
sure
ma'am. We
nobody
can
has
discuss.
any. Ek minute, let me see. I think somebody had put up a question earlier.
Yes,
Oh, there are so many questions. Sorry. Chalo, let's see what is happening. Oh, they are mainly complaints of voice. Can it be? So, जी हाँ कहाँ से शुरू करें? शुरू से voice breaking, chronic etiology, TB, SOGIA. Yeah, fever not touching the baseline. So whosoever has put this is very good. Voice is breaking. Switch off your video. Immunocompromised child, very good. JIA. Now, if somebody would have written their name, it would have been nice. Anti-CCP. So anti-CCP antibodies, yes, they help us in diagnosis of rheumatoid arthritis in adults, and in children, we do not require them to diagnose seropositive polyarticular JIA, but their presence does tell us that the arthritis is likely to be more chronic and more erosive. So they are more helpful in prognosticating the arthritis severity rather than helping us make a diagnosis. Please remember that the diagnosis of juvenile idiopathic arthritis is largely clinical. It's
clinical
a
diagnosis.
diagnosis. Now, ACD matlab anemia of chronic disease. Okay. Migratory pattern. How do we expect presentation of scurvy? So, scurvy is a very painful condition because there is a periosteal lift, there is a subperiosteal bleed in scurvy. So, if a child presents with if a child would be presenting with swollen bleeding gums, then of course the presentation of scurvy is pretty simple. But if a child presents to you with articular involvement of scurvy, then that is typically, it is a swelling just around the long bones. So you may find the swelling around the ankle or the knee, but it is extremely painful. These children are not able to bear weight, nothing. And on the x-ray, you see subperiosteal lift. So then when you look at their, their MRIs or all, then you'll see there is a subperiosteal lift. So it is extremely painful. So as I said, the inflammatory pain, please answer 3 questions and that will guide you towards an inflammatory pain. Your first question is the pain, when is the pain more? Is it more in the morning, afternoon, evening, or through the day? So when this pain is more in the morning stiffness is more associated with inflammatory arthritis. And then you say that, okay, yes, this pain is more in the morning. Then is it getting relieved with exercise or getting relieved on rest? So the pain of scurvy would be getting relieved at rest because it's a subperiosteal bleed. They are microfractures. So these children get, it's extremely traumatizing. So the pain of JIA is totally different. It's a more diffuse chronic pain and children get used to it. They may be having 5, 6 swollen joints and still running around. So that is how scurvy is different. Now, can it be SOJIA? Yes. Transient synovitis. So transient synovitis is transient, no? So it will last for less than 6 weeks duration. That is when we call it transient synovitis. And typically transient synovitis afflicts the hip joint. उसके लिए हम ज़्यादा term use करते हैं transient synovitis, which where an effusion, secondary to any infection, you may get a secondary to any viral infection. Mostly you can get a effusion of the hip joint, and it usually occurs in the boys, and for some reason it's usually the left hip that is involved, and then it gets resolved within 4 to 6 weeks. That is transient synovitis. Abscess, of course, this is not an abscess. Infective, I don't know what you mean. We've already discussed, and somebody actually thanked me. Okay. So I think we've covered everything. We're almost reaching to the end of our time. And somebody wants to, Shubham, I think we can skip the discussion. Everybody can go and read Systemic GI on their own.
Okay, ma'am.
Yeah. All
Yes,
right.
ma'am.
So,
Okay.
Gaurav,
Thank
is it
you so
okay?
much,
Can
ma'am.
we stop the session? Chalo, I'm sure Gaurav will agree with us. Okay.
Okay.
Take care.
Thank you,
Thank you,
ma'am.
Shubham. Good night, everybody.
Thank you, ma'am.
Bye. Good night.